Elise is a long-time user of VAC therapy, tending to use it on patients with open or highly exudating wounds. The VAC therapy device delivers negative pressure, like a vacuum, into the wound bed to help facilitate the removal of exudate and infectious material, whilst also pulling the edges of the wound together and promoting new growth of tissue to help close the wound. Studies have demonstrated that VAC therapy not only helps improve patient outcomes, it has the potential to help facilities and payers lower their overall cost of care by reducing readmission rates, total nursing time, and associated length of hospital stay. VAC therapy offers Elise many different wound care options depending on the goal of therapy. VAC granufoam and VAC simplex dressings when Elise requires granulation tissue growth. VAC granufoam bridge dressing when offloading at the wound site is required, perhaps at a sacral pressure ulcer or foot ulcer. VAC white foam dressing, with its higher tensile strength, allows for easy removal from tunnels and undermining. VAC granufoam silver dressing to help reduce or control infection. Elise's current patient has a dehisced surgical wound. She decides to use VAC simplex dressing as it is easier and quicker to apply than a regular VAC granufoam dressing. Elise begins by assessing the wound bed and prepares the wound according to her hospital protocol. If available, she applies a 3M Cavalon no-sting barrier film wipe to protect her patient's peri-wound skin and allows it to dry completely. Elise carefully tears or cuts the VAC simplex dressing along the perforation lines. She avoids cutting the foam over the wound as fragments may fall into the wound. Elise gently places the foam pieces into the wound cavity, ensuring contact with all wound surfaces without overlapping onto intact skin. She counts the number of foam pieces placed in the wound and records it in the patient record. Then, Elise trims the VAC drape to the appropriate size. She applies the first drape, peeling back layer 1, and places it adhesive side down, avoiding folds. Once fixed in position, she removes the green strip on layer 2 and the blue handling tabs. She repeats these steps with the second drape, overlapping the drape with the first drape. She pinches the drape and cuts a circular opening the size of a €2 or 10p coin in the field. Before applying, Elise carefully considers the pad placement that is most comfortable for the patient. She then removes the backing layers of the VAC SensorTrack pad and applies it directly over the opening. Next, depending on the unit available, Elise connects the VAC canister to either the VAC Ultra Therapy system or the ActiVac therapy system, and then connects the SensorTrack tube to the canister. The units are set by default to continuous negative pressure of 125mm of mercury, but Elise can easily adjust the default settings by selecting Advanced Settings on the VAC Ultra Therapy system or Therapy on the ActiVac therapy system. Once the therapy is initiated, the unit will run a seal check feature to determine if there are any leaks. When completed, the therapy will be activated. Elise must remember to change the dressing every 48 to 72 hours, no less than 3 times per week, to ensure safe use of the therapy. VAC therapy is engineered with SensorTrack technology, a proprietary technology that maintains and adjusts to deliver set pressure at the wound site, so Elise can be sure the settings or programmed therapy is indeed the therapy that is provided to the patient. With a large body of evidence, proven clinical and economic outcomes, and 24/7 clinical and technical support, VAC therapy is Elise's preferred choice of negative pressure wound therapy.